All right, today we're going on a journey to really understand pancreatic cancer, from its hidden beginnings all the way through diagnosis, treatment, and care. So let's just dive right in.
The whole story of this disease really boils down to one central problem, and this quote says it all. Pancreatic cancer is just a master of disguise, and that's exactly why it's so often found when it's already late in the game. So that naturally leads us to the two big questions we're going to explore. First, why is this cancer so darn elusive? And second, once you do find it, what does the fight actually look like?
Well, the first clue to its stealthiness is just basic anatomy. Your pancreas is kind of like a hidden command center, tucked way back behind your stomach, intestines, and liver. Because of where it is, a tumor can grow for a long time without causing any obvious problems or being felt in a routine checkup. It's just buried.
Okay, so before we even get to a diagnosis, we have to ask a fundamental question. Who is most at risk? Figuring this out is really the first step on this whole journey.
The source material points to a few major risk factors. You've got things related to lifestyle, right, like smoking and obesity, but then there are also pre-existing conditions, like chronic inflammation of the pancreas or cirrhosis of the liver. And of course, age is a big one. The risk really climbs after 65.
Now, this is where we see a really concerning gap in healthcare. The data here shows that Black patients are often diagnosed at a later, more advanced stage of the disease compared to white patients. There's a clear disparity in how early this cancer is caught between these groups. And one of the contributing factors mentioned is that Black patients often have less insurance coverage, which can create barriers to getting that early care.
So let's keep moving. If this cancer is so good at hiding, how in the world do doctors even find it? Well, the whole diagnostic process is basically like a piece of high-stakes detective work. And the clues that doctors have to work with, they can be incredibly subtle and easy to brush off as something else. Jaundice, the yellowing of the skin and eyes, is a big red flag, but it often shows up late. The other signs, like a dull ache in your abdomen, losing weight for no reason, or just feeling tired, those could be a million different things, right? That's what makes it so tough.
So think of the diagnostic path like a funnel, designed to zero in on the truth. It usually starts broad, with blood tests and a CT scan, to see if anything looks off. From there, they move to what the source calls the gold standard, an endoscopic ultrasound, or EUS, which gives them a super detailed view. But the final, 100% confirmation only comes from a biopsy. They have to get a tiny piece of tissue and look at it under a microscope to say, yes, this is cancer.
Okay, so once the diagnosis is confirmed, everything shifts. It's time to build a battle plan. And this isn't a one-size-fits-all thing. It's totally personalized based on the patient and just how far the cancer has progressed.
Broadly speaking, the treatments fall into two main camps. On one side, you've got non-surgical options. Think chemotherapy using powerful drug cocktails like FOL4-NOX or radiation to help with pain. But, and this is a huge but, the source is crystal clear on this. The only truly effective treatment is to surgically remove the entire tumor.
And the main surgical weapon for cancers in the head of the pancreas is this massive operation called the Whipple procedure. And as you can see, this is no small thing. We're talking about removing the head of the pancreas, plus parts of the small intestine, the gallbladder. It's a huge undertaking.
And here's where it gets absolutely incredible. After taking all that out, the surgeon basically has to rebuild the entire digestive system's plumbing. They have to make 3 major reconnections, or anastomoses, just to make sure everything can function again. It's really an amazing feat of surgical engineering.
You'd think getting through an operation like the Whipple is the finish line, right? But in reality, it's just the start of another incredibly tough journey. The period right after surgery is absolutely critical and requires constant, intensive care.
And the reason for all that intensive care is the huge risk of serious complications. Just look at this table. The medical team is on high alert for everything from major bleeding and heart issues to pneumonia and bowel obstructions. The body is just in such a fragile state. But out of all those potential problems, the source flags one as being both the most common and the most serious: a fistula. This is basically a leak at one of those new surgical connections. And because pancreatic fluid is incredibly corrosive, a leak inside the body can cause devastating damage and infections. It's a huge concern. So, to try and lower some of these risks, there's been a really important shift towards minimally invasive surgery. By using robots or laparoscopes, surgeons can do these incredibly complex procedures through tiny incisions instead of one giant one. And the benefits for the patient are huge.
We're talking a faster recovery, less pain, and a lower chance of those severe complications we just saw.
You know, all of this, the diagnosis, the surgery, the recovery, it's only part of the picture. The final and maybe the most important part of this whole journey is about caring for the entire person, not just the disease.
A strong support system is absolutely crucial, and that means emotional support, not just for the patient, but for the family that's going through it with them. It means bringing in palliative and hospice care teams whose entire focus is on quality of life and managing symptoms. And it means having case managers to help navigate the complicated path from the hospital back to home. It's a team effort.
And that really leaves us with one final thought. We've walked through the whole medical journey, from a hidden tumor to this incredibly complex surgery. But what this really asks us to think about is, in a fight this tough, what does it really mean to care? It's so much more than just the medicine. It's about dignity, it's about quality of life, and it's about supporting the human being at the very center of it all.